I'm State Representative John Payne of the 106th District in Dauphin County. Thanks for joining me for this V-Clip. Late last year, Stan Saylor, who's chairman of the Policy Committee, held a hearing in Pittsburgh. We were at the Children's Hospital and McGowan Institute out in Pittsburgh and saw some fascinating new medical technology. On the way back to the hotel, Stan asked me, what are we doing in Hershey? What are we doing at the Med Center that is like this kind of technology? I told him that we have a brand new facility called HCAR, Hershey Center for Applied Research, which is located right across from the Lifeline hangar, and that I knew we were doing neat new greenhouse technology, just like Pittsburgh's, right here in Hershey. This short V-clip you're about to see is part of the public hearing we held at HCAR.
When I started in school in '74, the cure rate for children with acute lymphoblastic leukemia, the most common form of leukemia in children, was about 10% at best. Now at the Penn State Hershey Children's Hospital and Cancer Institute, it's over 90%, well over 90%, closer to 95%. Talk about progress. And all of that is due to physicians and scientists working at the task of discovery, and also to places like HCAR, moving those discoveries out into the community for the good of all. Let me talk about a couple of, actually three, of the great innovations that have come out of the College of Medicine and that are now flowing into development. And this is the device we're talking about. This is a chest stabilizer. It reaches over and around the chest. It attaches through tiny suction cups, and it holds the chest open when the baby starts to breathe. The advantage of this is that it helps keep the lungs inflated, and it may prevent the need to put the baby on a respirator. The second invention I want to discuss with you is developed by Dr. Randy Hallock, a professor in the Department of Surgery. And the purpose is to train surgeons to use laparoscopes in a better way. This technology teaches the surgeon, the operator, how to make right-angle turns with this instrument and how to negotiate the abdominal cavity. And finally, this instrument, or set of instruments, is designed to repair broken ribs. In the past, the way to stabilize a rib was to make a long incision in the chest, open it up, expose the ribs, and wire them together, or otherwise harness them together with appliances. Our surgeons have developed a very clever technique. You take a short piece of metal like this with two screws coming in, and you use what I was talking before, a scope. You make a small incision, like this big, not that big. You put this under the rib with the scope guiding you. You drill a couple of holes in the rib, and then these two escutcheons pop through. And then this device goes through very small holes, it's really a screwdriver, and tightens these, right? And that will be sufficient to retain the rib. You can put 2 or 3 of these in if the rib is broken. You can do this in an hour, and you'll have a series of small 1/2 to 1/4 inch incisions rather than that monstrosity. And these can remain with the patient the rest of their life.
Our lead compound is the ABC 294640. Which was selected from hundreds of compounds. We did extensive screening and several animal models to pick this one based on its safety and its efficacy in several disease models. We see dramatic results in our preclinical and animal studies with cancer cells. The left panel shows a tumor cell. It's intact, it's growing. They grow much faster than a normal cell, resulting in tumors growing quickly. When the tumors are treated with the 640 compound, a process called autophagy happens, where the tumors begin to break apart and die. Once it starts, it's an irreversible process. These tumor cells die, the signals are spread to their neighbors, tumors regress, and eventually are killed. That has us very optimistic that not only can this be a standalone drug, but it can also combine with a lot of the standard of care drugs that are on the market with the big drug companies, which would hopefully entice them to partner with us.
What is age-related macular degeneration? This is a chronic progressive eye disease of the retina These are the cells in the back of your eye that actually catch light and allow you to see. It is irreversible. It's like when you lose brain cells from a stroke. Once your retina has died, you're permanently blind until we invent prosthetic retinas, which is Buck Rogers science fiction at this point. Apellios Vision Science has created a screening box, and this is a tabletop box that can test your ability to your night vision. The cells that are affected in the eye first are responsible for night vision. This box then measures how fast you adjust to darkness in a very rigorous manner, and we can make a diagnostic determination whether or not you have the disease. A very high sensitivity and specificity.
Thanks for joining me for this V-Clip. I wish you the best and prosperous in 2011 and look forward to sending you more V-Clips with exciting information. Thank you. That's all the time we have. I'm John Payne.